with Labour's plan to reform the NHS. Listen to Camilla Tominey from GB News in this interview with Wes Streeting, the Health and Social Care Secretary, about arm's length bodies and DEI in the NHS.
Should you be getting a PIP payment for ADHD, yes or no?
I think it very much depends on the nature of the condition and the severity.
ADHD, a PIP payment.
So I think it very much depends. We are looking at this whole issue of eligibility, and we are looking at this whole issue of overdiagnosis because I am concerned that we have overdiagnosis of these conditions.
All right, the jury's out on PIP payments. Should you be getting a 52 grand BMW from the Motability scheme if you've got ADHD? Why on earth do you need a taxpayer-funded car with ADHD?
I think that's a very good challenge, and one of the reasons why we are looking at the whole issue of welfare reform.
Although only this month, there's a role advertised in the southwest of England for an NHS diversity, equity and inclusion manager on, wait for it, 122 grand. Why are they still advertising for these roles? Can the NHS, with a waiting list still at 6.3 million, afford to be spending 122 grand on a DEI role? What's going on?
Because we've got black women 3 or 4 times more likely to die in childbirth.
Okay, but that's great.
Black men twice as likely to die of prostate cancer.
Okay, but so Mr. Streeting, why are these roles still being
to deal with? And that's
why are they still being advertised? Why are they still being advertised? If you're cutting down on them, why are they still on websites?
Yep, well, I think it is fair to say it has taken a little while for some people in the NHS to get the message. I think the announcements in recent days will have sent a very strong and clear message.
Okay.
But I want to make sure that every penny of taxpayers' money is being well spent. But I would say on this issue of diversity, equality and inclusion, some of that work is really important and valuable in terms of, poorer people more likely to die than richer people, men dying earlier than women, and real differences of the experience of black women in childbirth than white women, for example, in terms of black women being far more likely to die. I think everyone would agree those are issues we should tackle, and that's where a focus on equalities can make a real difference. But what we see too much of, and you guys have covered this quite extensively, are some well-meaning but totally misguided approaches, and that's what we'll be putting a stop to.
Back to the abolition of NHS England. I think so far since Labour have taken office, you have got rid of 2 quangos, but you've set up a new one for every 2 weeks that you've been in power. So we've now got 27 new quangos, along with countless reviews. So it's all smoke and mirrors, this, isn't it, Mr. Streeting?
Well, people will judge us on the results at the next election.
Why then create more arm's-length bodies?
Sometimes the 19th century. Well, sometimes there is a role. So, for example, one of the arm's-length bodies in my department, the National Institute for Clinical Excellence, set up by New Labour when we were last in government, has done a brilliant job of driving down the price of medicines and strong-arming powerful big pharma to give us a good deal on price and to get patients access to latest medicines. So that's an example of how sometimes those reforms and those bodies can be impactful. But are there too many? Absolutely. And that's why we're trying to reduce the number.
The government's responsibility is to serve all of its citizens, regardless of their colour, class, race or gender. The government is responsible for ensuring that they put in place policies and systems that will benefit each individual without focusing on colour, race or gender. How about creating a policy that allows people who can afford to pay for their health care to pay? This would give the government additional income, which would ensure that those who can't afford to pay are taken care of with dignity. Subscribe, like, and leave a comment if you have benefited from this video.